Hello, everyone, and welcome to today's webinar, Galvanizing Strategic Public-Private Engagement. I am Nelson Gitonga, the CEO with Insight Health Advisors and a partner with APT in the Shops Plus project. This is the first event in the Shops Plus Accelerating Private Sector Engagement End of Project series. Sustaining health outcomes through the private sector project is USAID's flagship initiative in private sector health. And since 2015, through the project, we have sought to catalyze public-private engagement to improve health outcomes. The other events in this series will cover health financing, health markets, and then a look back at the project's work with a discussion on what the future holds, what's next. I hope that all our participants who have logged in have had a chance to view the video introduction from USAID and the overview of the project from our project director, Susan Michelle. They are both available on the Shops Plus project website, and that is shopsplusproject.org EOP series. You can register for the other 3 upcoming events too in that website. Next slide. In terms of logistics, we are recording this event. It's good for us to let you know, and plan to send the recording to all the registrants next week for your review and learning. During this event, everyone will be muted, but we do want to hear from you, please. So please use the chat function to comment, to ask questions, or even to share relevant experience and examples from your own work. We will have time at the end to answer any questions you share through this event. And if you'd like to adjust your audio or any other settings, you can do so by clicking on the More Options button, the 3 dots, and make the necessary changes. In case you have any technical difficulties during this webinar, please ask our host, Kyla Thompson, for help or support. Next slide. So today's webinar will focus on what we have learned as Shops Plus project about improving stewardship to galvanize strategic public-private engagement in the health system. We'll hear from our Global Public-Private Partnerships Advisor, as well as from 3 country programs to highlight how we have addressed challenges to improve stewardship functions in the countries that you have operated. There will be plenty of time for you for Q&A at the end of the session. So as we go along, please think of some questions you'd like to ask or even experiences you'd like to share. Next slide. You'll hear from a range of presenters today representing the Shops Plus experience around the world. Like I said, I'm Nelson, currently serving as a PPP advisor for Shops Plus. And I would like to introduce my 3 presenters. First is Marian El-Khoury, a research, monitoring, and evaluation lead with APT Associates. And Marian is working on Shops Plus Francophone portfolio. Next will be Nicole Capesi, a senior program officer with APT Associates and working on Shops Plus in Tanzania. And finally, Kamal Khanna, the chief of party from APT Associates for Shops Plus in India. So those are the 3 presenters that we will listen to today and have a discussion. But before we go to our presenters, I would like to start by setting the scene or the stage by providing a bit of a framing and background for our discussion today with regards to stewardship. Next slide. So I would like to begin by defining, next slide, what we mean when we use the term stewardship. Stewardship is a very broad and old term, and sometimes is a vague concept to many and can mean different things depending on the context. But for our purposes today, stewardship speaks to the public sector's systems, mechanisms, processes, institutions, and the ability to steer both the public and the private sector in the health system together to achieve a desired public health outcome. So that would be the working definition for our webinar today. And when we say private sector, we mean the full range of non-state actors, including for-profit actors, NGOs, faith-based organizations, and civil society that are active in the health sector. Effective stewards are able to understand and appreciate the full range of available resources in the health system and align and target government, donor, and private sector investments to optimize health outcomes. Next slide. So if stewardship is a government function, one would wonder why we are talking about it today in a panel that is focusing on the private sector. But there is a good reason why we are doing that, because there are many different functions that government stewards perform that have direct or indirect impact on how the private sector operates. Examples include developing policies and strategies to guide investments in the health system, monitoring the performance of the overall health system, both public and private, regulating private providers and markets for specific health products, and also purchasing care from private sources on behalf of citizens through different mechanisms, whether it's a social health insurance scheme or a service level agreement. When stewardship is done well, these functions can help to orient the private sector towards public health goals, which is a very important point. It can also help target government and donor resources to create space for the private sector and minimize crowding out of private sector investment, which is normally a loss for the overall health system. Properly done stewardship can also help to remove financial barriers to care and overall improve the efficiencies and effectiveness of the overall health system. Next slide. Effective stewardship doesn't only benefit governments. It also has a great impact and benefit on the private sector as well. And when stewardship is done well, private sector can also reap a lot of rewards from an effective stewardship function. Examples include increased recognition from the government that the private sector brings on board, and the role that the private sector can play to complement or supplement the government in achieving its health goals. The second benefit could be policies and regulations developed that better support the operations and the growth of the private sector. And finally, and very important, it provides better designed opportunity for better designing public-private partnerships to deliver priority health products or services and grow the overall health market. Next slide. We know that many countries don't effectively perform their stewardship function, though. There are a multitude of reasons for this, and I'm sure all of us know a number, but I'll just mention a few of them. First is there is limited data to appreciate and understand and plan for private sector contributions, including knowing where private providers are located, the kind of services and products they provide, and which clients they serve. The second challenge is limited mechanisms or platforms or limited incentives for public-private engagement, which can breed mistrust and reinforce ideological opposition, especially when the two parties are not engaging in a regular and structured manner. And the final example of a challenge I want to mention is a fragmented private sector that weakens its ability to participate in stewardship processes and give government the resources it needs to effectively perform its functions. A fragmented private sector also is difficult for the government to engage from a practical point of view. Next slide. So today, our panelists that I introduced at the beginning will speak to 3 of our country programs that we sought to address and overcome these challenges that I've mentioned and improve government stewardship of the private sector. First, Marianne will talk about our work in Senegal to improve the government's ability to sustainably generate and use data to better leverage private sector resources in its policies and programs in the health sector. After Marianne will come Nicole, who will present our work in Tanzania to strengthen regular or structured public-private engagement and also show how we sought to help government better own and recognize the value of building its capacity to manage this engagement. Finally, Kamal will speak about our experience in India to amplify private sector voice to address and overcome challenges in the condom market in India. So with that background, I want to immediately ask Marianne to come on board and talk to us about our experience in Senegal. Welcome, Marianne.
Thank you, Nelson. Hello, everyone. My name is Marianne. I'm a research, monitoring, and evaluation lead and regional manager at Apt Associates. And today I'll be talking to you about Senegal. Next slide, please. So the story in Senegal begins in 2014 when 3 key developments showcased the commitment of the government of Senegal and the Ministry of Health to promote the development of the private health sector. The first is the creation of the Private Health Sector Alliance. This alliance was formed to bring together and organize various private health sector organizations in the country. The second is the establishment of a public-private partnership unit within the Ministry of Health. And the third is the establishment of a public-private dialogue forum called the PPP Technical Committee, housed within the PPP unit. These 3 developments created a centralized hub for public-private dialogue in the country and generated momentum for public-private engagement and partnership. Next slide, please. Now, fast forward 2 years. The 2016 Private Sector Assessment, or PSA, that was conducted by the SHOPS project, which is the predecessor project to SHOPS Plus, found that there was little known about private health facilities in the country, how many there are, where they are, what they do. Now, the government of Senegal recognized that this lack of accurate information on the true scope and scale of the private health sector stood in the way of it playing an effective stewardship role. In fact, the story of Senegal is not one of a lack of political willingness, quite the opposite. Both the ministry and the private sector alliance were committed to move forward their partnership agenda. Now, basing their decision on the results of the PSA, the government requested a census of the entire private health sector in the country. The SHOPS Plus program in Senegal ran between 2017 and 2020 and was largely designed based on the findings of the PSA. The census was one of the first activities that the program facilitated as part of strengthening the stewardship capacity of the government of Senegal. Next slide, please. Now, the private sector census was completed in 2018 and was the first systematic effort to accurately capture and map all private health facilities in the country. SHOPS Plus, with the collaboration of multiple country partners, went door to door to every private health facility in the country, from clinics to hospitals to pharmacies and drug shops, updated facility lists, and collected information on each facility and its operations through face-to-face surveys. Next slide. Now, in keeping with the theme of strong political will, the census in Senegal was the perfect example of strong and effective country ownership. The PPP Technical Committee that was established by the Ministry of Health acted as steering committee with a mission to engage all relevant stakeholders. The committee included representation from various divisions of the ministry and private sector actors, such as the alliance and professional associations. Now, I've listed on this slide just a handful of the various entities involved in the process. It was truly a collaborative effort grounded in a series of consultative meetings and workshops where SHOPS Plus and country partners discussed design, developed plans, solved problems, and validated findings. Next slide, please. The census identified more than 2,700 private health facilities nationwide. The participation rate was very high. 96% of facilities approached agreed to be surveyed. Importantly, government stewards now have access to a wealth of information about the private sector. Everything from number of facilities, their types, their location, their staffing structure, what health services they provide, and many more. To name a few examples, we found that 45% of private facilities in Senegal are pharmacies and drug shops, and that 90% of facilities are for-profit. 43% offered family planning services, and more than half told us they needed training on business and financial management. Next slide, please. Senior officials in the government embraced the census findings. In fact, no one questioned the results, primarily because everyone was involved in every step of the way, and everyone recognized the value of the exercise. And here's a quote by the Secretary General at the Ministry of Health. And I quote, "The private sector census will enable access to a comprehensive database of private sector health facilities in Senegal and will strengthen current interventions, particularly in FP, HIV, and maternal and child health." Now, at the very least, the results built consensus on the important role of the private sector in health. At the end of the exercise, SHOPS Plus transferred the database to the Ministry of Health, who continues to update it. It is currently housed at the private sector division of the ministry. And last we checked, more than 360 new private health facilities had been added to the database. Next slide. Now, the information from the census re-energized country actors and paved the way for more engagement and better stewardship. And importantly, it did so at the decentralized local level. We disseminated the census findings in all 14 regions of the country. The Private Health Sector Alliance, which was created at the national level, was now visible at the regional level, and the alliance moved forward to set up offices in each region and was able to start dialogue with the public stewards at that level. The census also led to an effort to start incorporating private sector data to encourage sustainable reporting. In fact, it was the regional and district health teams who advocated for that integration. Importantly, the data facilitated responses to public health emergencies. The government used the census to identify and conduct outreach to private facilities in the Dakar region during the start of the dengue fever epidemic in 2018. It also allowed the government to engage early on with the private sector in the COVID-19 pandemic response. Next slide. Now, the Senegal story offers important lessons. First, the existence of engagement mechanisms, what Nelson was saying, and in this case, such as the PPP unit, the technical committee, and the private sector alliance, facilitated this joint ownership and the successful implementation of this exercise, and I'd venture to say any joint activity in the future. There was no need to spend the time and effort in this case to figure out how to involve the private sector in the census because the alliance represented that common private sector voice. And there was no need to convince either party of the need to dialogue and partner because a PPP unit in the ministry was already established. Again, these mechanisms provided a strong anchor for all parties involved. Second, there's a need to give effective dialogue and engagement the time they deserve. The process is lengthy, tedious, and requires compromise. And this may sound obvious, but it is easy to underestimate how much time it takes to bring together multiple actors with various interests and agendas to sort through and discuss and prioritize actions. However tedious, though, this process is necessary to get buy-in of all parties and support across the board. And third, and going forward, there's a need for user-friendly data platforms and cost-effective processes that allow not only the routine capture of private sector data, but also its easy access and use by stakeholders. We need ways to allow and incentivize private providers to self-report directly and systems that allow stewards to use that data on a routine basis. And with that, I thank you very much for your attention and I look forward to the discussion. Over to you, Nelson.
Thank you so much, Marianne, for sharing that interesting example from Senegal of how you generated private sector data through the census and how government has owned it and even started applying it, including on recent challenge of COVID. I have a question for you, just to clarify. You talk a lot about national level stakeholders generating and using and owning the data. Are there examples of local or subnational or district level governments using these census data?
Thank you, Nelson. And yes, there are. And I'll mention one example, which is just as we completed the census in 2018, the first dengue fever case was detected. Actually, it was detected in a private facility. What happened is that regional health teams wanted to reach out to health providers in their own region, and including private providers, and wanted to train them on how to detect and report and address these cases using the ministry's protocols. So they used the census to locate and reach all these private providers, something they wouldn't have been able to do without that complete list of facilities. And in fact, the same thing happened with COVID-19 2 years later. Over to you.
Thank you. Very interesting. I think we'll discuss that more at the Q&A session. Thanks, Marian, for illustrating how the Shops Plus project has tried to address the challenge of having reliable and timely data on the private sector. Next, we are going to have Nicole Kapesi from Tanzania, who will speak to us about Shops Plus work to strengthen mechanisms for public-private engagement in Tanzania, which was the second challenge that we talked about. Welcome, Nicole. Sorry, Nicole, you are muted.
Thank you. Thank you for the introduction, Dr. Nelson, and hello, everyone. As previously introduced, my name is Nicole Kapesi, and I serve as a Senior Program Officer on the Shops Plus project in Tanzania. I will be sharing how we work to strengthen platforms for engagement in the country. Next slide, please. So allow me to start by telling you where we came from. In 2012, USAID, the World Bank, the Ministry of Health jump-started efforts to improve public-private engagement in Tanzania's health system. Prior to this, the government had primarily focused on managing the public health sector. In the same year, the government and development partners came together to engage the Global Shops Project to conduct a private sector assessment with the aim to build better bridges between the public and private sectors. The assessment reports highlighted many opportunities, but it also surfaced a key barrier that was that Tanzania lacked functioning mechanisms for routine effective engagement, which are key for establishing public-private partnerships. The assessment also highlighted that the public and private health sectors operated largely independently of each other, with limited dialogue and high levels of mistrust. So coming out of this assessment, USAID tasked SHOPS and SHOPS Plus with creating a roadmap for accelerating public-private partnerships in Tanzania's health system. The roadmap highlighted improving the ability of the government to steward the private sector by strengthening mechanisms for routine dialogue, to increase awareness of the private sector's role, build trust between the sectors, and improve resource planning and targeting across the overall health system. Next slide, please. So to implement the strategies within the roadmap, the project over the years has worked to help government understand the value and importance of better engagement with the private sector. To realize these efforts, the project began by making a health case to integrate the private sector into the health system. We did this by using DHS data and other tools to develop scenarios that demonstrated the private sector's current role in the health system and the possible burdens that the public sector would have to take on if that role was not better supported. These efforts were largely driven by building the stewardship capacity of the HIV and family planning program, or the HIV and family planning market stewards at both national and subnational levels. Next slide, please. This graphic here provides a quick example of a scenario that we presented to the family planning program market stewards, and it was built using the SHOPS Plus developed family planning market analyzer tool. So we basically explored what would happen if a lack of product occurred in the private sector due to decreased donor support. This graph shows user distribution across sectors when population growth is factored in. This scenario here demonstrates the additional burden that the government would have to take on if private sector supplies of injectables and oral contraceptives declined, depicting an increase of almost 400,000 women sourcing injectables from the public sector between 2017 and 2020. For context, it's important to note that at the time, for a number of reasons, private sector supplies of these methods had already started to decline. So this visualization here of the impact of what was already starting to occur on government resources created a sense of urgency and momentum for government to act to understand and address the challenges that the private sector faced. Next slide, please. So as Marianne just mentioned, a lot of work had to take place at both the national and subnational level. This was no different in Tanzania. So this question was, I'd say, especially relevant in our country because there is what we have here is a decentralized health system. So our project strategy was to work at both levels, but to begin at the national level. Here, SHOPS Plus worked to ensure private sector representatives had a seat at the table in key policy-making forums and technical working groups. This national level engagement took time, but it resulted in breaking down silos and improved trust between the two sides. Having private sector at the table resulted in creation of stronger policy frameworks for the use of public resources to support private health markets, as well as strategies that better guided national officials in their efforts to engage private providers. At the subnational level, the project worked with regional and district coordinators to operationalize the policies already developed at the national level and broker partnerships with private providers. Next slide, please. The technical support provided by SHOPS Plus catalyzed interest by ministry departments to embed private sector principles and strategies within key policy documents that would guide coordinators on how best to engage both sectors for desired health outcomes. At the request of the ministry, we worked with the National HIV and RCH program as part of the policy review teams to contribute to how the Ministry of Health can engage, support, and leverage the resources in the private health sector. Some key national policy documents that the project contributed to are listed within the slide. And this is inclusive of, like the National Family Planning Costed Implementation Plan and the Multi-Sectoral Condom Strategy. Another key achievement has been the standardization of import quality regulations that previously hindered commercial sector participation in health product markets. As a result of this improvement in the regulatory environment, commercial importers and distributors have been incentivized to increase their activity in the condom market, resulting in more than a doubling of annual sales volumes from 2.5 million to 5.5 million. Next slide, please. Beyond policy development, increased engagement between public and private stakeholders at the national level has helped the public sector make better use of its own resources. In the past, annual national quantification meetings for reproductive and child health, supply forecasting, and demand planning of commodities for the public sector supplies quantified for all Tanzanians. This process did not consider the role the private sector played in reaching some segments of the population. So through Shops Plus facilitation, the reproductive and child health section of the Ministry of Health incorporated sales and distribution data from commercial and social enterprises. This included, a 3-year supply side trends assessment conducted by Shops Plus in 2020. And the data from this assessment revealed that 92% of emergency contraceptive pills were supplied through the private sector. This data helped the government better understand the patterns they saw in their own supply chains, including expiry concerns, and right-size their procurements, leading to a year-on-year reduction in public emergency contraceptive procurement. So they could better target their resources toward those methods that were most relevant for the public sector. Next slide, please. In 2020 and 2021, after working at the national level for about 2 years, to establish a more supportive policy framework, Shops Plus began working with its government partners in the Ministry of Health and the President's Office responsible for regional administration and local government to roll this work down to the subnational level. This work sought to build platforms to improve the ability of regional and district officials to implement the policies and strategies and increase effective private sector engagement. To date, these platforms have helped stakeholders create and begin implementing district-level action plans that seek to support stronger stewardship at local government levels. And these cross-sectoral platforms have facilitated increased linkages between local government and private sector networks to support private provider access to government-provided clinical trainings. They've also supported the use of commodity agreements that allow private facilities to distribute subsidized government-managed family planning and HIV commodities. And they've also strengthened supportive supervision and standardized quality regulations of private health facilities, pharmacies, and accredited drug dispensing outlets or drug shops by district health management teams. Next slide, please. The work in Tanzania has highlighted several lessons for improving government stewardship. 3 key lessons that we have taken away are that we quickly learned that it was important to talk about more than just opportunities in the private sector in order to motivate public officials to change their practices. People are risk adverse, and public officials are no different. We found that highlighting the costs of not changing behavior, as we did in our initial advocacy work with injectables, resonated just as much, if not more, with public stewards and helped them understand the value and need to improve engagement with the private sector. The second learning is that we have also demonstrated that simply improving the regulatory framework can be an effective incentive to private market actors. And this improvement doesn't always require new policies or regulations. The quickest changes in the condom market resulted from simply harmonizing import quality regulations rather than creating new ones. Private sector is, constantly monitoring markets, and they're poised to act if they see an opening. Thirdly, in a decentralized context like Tanzania, we've often seen people start small at the local level and then try to replicate or scale interventions nationwide. We spent a lot of time working at the national level to get the policy environment right. While this slowed our ability to work at the local level in a unified way, once we were ready, we were able to start working almost nationwide with local councils and regions to come up with action plans for improving their stewardship functions. And the national level support helps, to accelerate rapid engagement at this level. And with that, I'd like to thank you so much for listening, and I look forward to further discussions.
Thank you, Nicole, for that very interesting example of how you worked to strengthen engagement platforms in Tanzania, beginning at the national and then cascading to the sub-national level. In your presentation, you focused a lot on the public sector and getting them to participate in these mechanisms and platforms, including at the local government level. What about the local private sector, especially the ones at the district levels? How did your program support these platforms and their data use for engaging with the government? Hello, please unmute. Thank you.
Thank you, Nelson. I keep forgetting to do that. But great question. Thank you very much. So the project provided technical assistance to the leadership of drug shop networks. In Tanzania, we call them ADOs, which is an acronym for Accredited Drug Dispensing Outlets. And these networks are called ADO associations. So what we did is we helped them organize their data in a way that can be utilized for advocacy. An example is the use of oral and emergency contraceptive pill dispensing data to advocate for increased family planning scope for drug shops to include youth-friendly services. Other associations have also been able to use their data to engage their district pharmacists meaningfully. And in districts where this has happened, we're seeing more recognition of the role of these last mile platforms. As complementary to offering services as family planning for young and unmarried segments of the population, who, as you know, DHS tells us prefer sourcing from such platforms. Thank you.
Thank you, Nicole. And I can see a lot of robust action on the chat with regard to what you're sharing. I think we'll discuss a Q&A. I think next we are going to invite Komal from India. Komal will speak about the Shops Plus work in India to amplify private sector voice and improve private sector participation in stewardship systems. Welcome, Komal.
Thank you, Dr. Nelson. Good morning, good afternoon, and good evening. My name is Komal Khanna, and I'm the Chief of Party for Shops Plus Project, a USAID-funded project in India. And I would like to share with you Shops Plus India's exciting journey of amplifying the private sector voice through the formation of Condom Alliance. Next slide, please. The journey of Condom Alliance began when Shops Plus, through its research and formative studies, concluded that the condom sales in India have been stagnating at 1% per annum CAGR, while the big condom brands were growing, but the overall condom market remained stagnant. And this low condom growth is primarily due to extremely low usage by India's 600 million youth, who make up the world's largest cohort of young people. Closer scrutiny of the reasons showed a lack of political will, unlike Senegal, leading to a restrictive environment with price ceilings on condoms and ban on condom advertising in the media from 6 a.m. to 10 p.m. in the night, and an unengaged and passive public sector giving no thrust to condom promotion as a contraceptive. This is compounded by socio-psychological barriers amongst the youth who have misconceptions and misinformation around condoms, and there is a stigma attached to condom use, and youth have a fear of judgment in purchasing a condom. This poses a huge opportunity and potential for market growth for condoms if we look at the situation from a broader lens of family planning as well as sexual and reproductive health. Hence, a need was identified for the key market players to come together with the common goal of reviving the condom market. Next slide, please. In a fragmented condom market, for the first time in India, Shops Plus brought together private sector actors on the same table to form the Condom Alliance. On this platform, we had condom market leaders of the country who held 50% of the condom market share. And these condom marketers and manufacturers have presence both in local as well as global markets. We had rivals and competitors agreeing to come together for the first time to build a shared vision with a unified voice. And this was to This was done to collaborate to grow the condom market and contribute to the health and well-being of youth in India. And secondly, to facilitate evidence and data-informed dialogues with the government, marketers, social sector, and donors. And lastly, but most importantly, to advocate to government for an improved enabling environment. Next slide, please. This has been a long road of 2 years to create a unified voice, beginning with 2019, when Condom Alliance had its first alliance meeting to decide on the focus areas. This has been a 6-month journey where the Condom Alliance had a ratified charter, along with a governance structure approved by the members and a secretariat established. And within a year, 3 subcommittees were set up and tasks were led by the Condom Alliance members to help kickstart the alliance. At the inception of the alliance, government was invited to be part of the first meeting, but after the initial reluctance, ShopSplus continued to inform and advocate with the government to be on this platform by sharing the deliberations of the meetings. And by the third meeting in February 2020, we had representation from senior officials of Ministry of Health and Family Welfare. And the Condom Alliance work continued during the COVID-19 pandemic. And in May 2020, dialogues were undertaken with the government on COVID-related challenges. By December 2020, Alliance had created its unique identity, logo, and tagline, shaping markets and opening minds. And just last month in May, the Condom Alliance released a condomology report that offers an understanding of the consumer psychology and attitudes towards the use of condoms, while highlighting the misconceptions and the barriers. And with the help of the media, the report aims to advocate with the government to take urgent action to create an enabling environment to educate the youth on condoms and reproductive health and support the condom industry. Next slide, please. After the initial engagement, the government turned to the Condom Alliance shortly as an advisory group to deal with the pandemic and sought Condom Alliance's advice to strengthen condom market during COVID-19. In May 2020, the government and Condom Alliance had a dialogue where they discussed the challenges in production, distribution, and demand generation during lockdown. The Alliance proposed to the government possible solutions to overcome and mitigate these challenges, such as lifting manufacturing and travel restrictions to manage the disrupted supplies, allowing them to service pharmacies, and inclusion of condoms in the government's list of essential services. The Alliance shared with the government crucial information regarding the manufacturing volumes that were needed to secure adequate stocks in the country. This helped the government to make a decision on whether condom export restrictions were needed. Following the Alliance's conversations with the Ministry of Health, the government ultimately decided not to restrict condom exports. 2 statements by senior government official reinforced the power of collective, which stated, extraordinary situation requires extraordinary response, and be together and act together. Next slide, please. In just 2 years, Condom Alliance has achieved early results and very positive results. The Condom Alliance, as a market steward, built a unified voice for a collective impact on the government to pay attention to the requirements of the condom marketers. To make condoms more resilient during COVID, condom market data analysis and insights from the behavioral economic study were shared by the Condom Alliance with the government. Condom Alliance launched a generic condom digital campaign for boosting the demand for condoms by normalizing condom usage amongst the youth after the government's refusal to partner in a mass media condom campaign. The Alliance also raised its visibility through a public relations agency. And to sustain the Condom Alliance beyond the ShopSplus project, ASSOCHAM and Associated Chambers of Commerce of India, the oldest and the largest Chamber of Commerce and Industry of India, was selected to transition the Condom Alliance Secretariat so that it could be sustained beyond the ShopSplus project. An industry association was chosen as it has strong contacts with various ministries, including the Ministries of Information and Broadcasting, Drugs and Pharma, as well as the Prime Minister's Office, which would be beneficial for continued engagement and advocacy with the government in the future. Next slide, please. The public relations effort is trying to raise the visibility of Condom Alliance as a market steward to advocate for policy change in favor of the condom industry. Further, the Alliance members have authored various articles on the price ceilings and advertisement restrictions that have appeared in 100 leading media publications, which are likely to be read by the key government influences. NDTV, India's leading TV channel, dedicated a talk show on the Condom Alliance with participation from an ex-government health commissioner along with the Condom Alliance members. And the Alliance has built its own website, Twitter, and a LinkedIn account, giving it greater visibility. Next slide, please. There have been great lessons learned in this 2-year journey of the Condom Alliance. Condom Alliance is actually working to establish the private sector stewardship to engage and influence the government to be an active contributor for long-term growth and sustainability of the condom market. However, government has trust issues and the willingness to work with private sector is not a given. Hence, continuous advocacy with multiple ministries is needed for an improved enabling environment. Moreover, government is wary of engagement with individual manufacturers as they fear being seen as favoring one manufacturer over the other, but prefer engagement with collectives. We realized early on that an alliance can be built in a fragmented market by having a shared vision that urges the corporates to go beyond the individual brand promotion. And as Dr. Nelson mentioned, complement the national health priorities for category promotion. Needless to say, an alliance needs champions to advocate for the cause. And we realized that finding a champion is not easy and keeping one is even tougher, given the frequent staff changes in the government as well as the corporate sector. Finally, any alliance needs patience, perseverance, and innovation as a key factor to build the bridge between the public and the private sector. And in the end, I'm happy to share that the Condom Alliance efforts to focus on increasing condom use and reviving the contraceptive market has not only aligned with the Government of India's commitment to Family Planning 2020, but also aligned with the United Nations Sustainable Development Goal 3 on ensuring healthy lives and promoting well-being of all, and also Sustainable Development Goal 17 on revitalizing global partnerships for sustainable development. And with that, thank you so much for the opportunity to share our story with you. We look forward to questions in the chat. Thank you so much.
Thank you. Thank you very much, Kamal, for that interesting example of how you galvanized and mobilized the private sector to come together and engage the government to tackle a specific health market, health need. Very interesting findings there, even including the importance of approaching the government as a collective or association rather than individual private actors. One quick question I have for you before we go to the open Q&A. In this example, we see the private sector leading and coming together to tackle the condom market. Can you give us any other concrete example of an outcome from this work other than the ones you have mentioned?
Yes, definitely. In fact, we had gone to the government early on to work together to roll out a condom mass media campaign, but the government refused. So the Condom Alliance actually rolled out a digital campaign to normalize conversations for the youth around condoms. And we released a music video titled, "Don't Be Dumb, Use Condom." And this video had a reach of 23 million youth in the country. The Condom Alliance members further amplified this campaign on their social media handles of Facebook, Instagram, Twitter, along with other youth brands like Lay's India and Boat Nirvana. So this was a fairly successful campaign. And I could just share a few details about that. The music video trended for 2 hours with 2,000 tweets and was watched 1.6 million times. With the video, there was a dance step challenge in which 30 choreography influencers and 90 youth made their dance videos. And we also increased the efficacy of the campaign and found that there was actually a 60% change in the perception of condoms from a pleasure dampener to a consent buyer and a smart choice. The share of condom conversations in the universe of sex-related conversations on social media saw a 64% growth, which is a huge achievement given that condom is considered a taboo topic in India. And this has been a very impactful campaign for us. Thank you so much.
Thank you. Thank you very much, Kamal. We are running out of time, so I want to quickly look at some of the very interesting comments and questions, but focusing on the questions. Thank you so much, our audience, for the questions that you have put. Our team at Shops Plus has responded to a number of the questions and also posted materials and sources that you can quickly have a look and would answer a lot of the questions you have. So for Marianne, I'll start with you. There are some interesting questions here regarding the private sector census in Senegal. I will leave the first few because they've been answered through the materials that have been shared, but maybe focus on a few others. The first one is, can we add some more details about what data helped reveal and how it's being used with regards to public versus private contributions? And any comment on private sector quality. The second question you can combine with that is, what incentives did the private sector have to participate and share in the data? What is the need for them? At question 5, what systems or regulatory practices does the government have that could be strengthened to capture this data on an ongoing basis? Over to you, Marianne.
Thank you, Nelson. All right, so for the first question, the data helped reveal that the private sector was a very important player in the market and was providing a wide range of services. By itself, this led to more advocacy for engaging the private sector. And in fact, it was the basis for many interventions involving the private sector. For example, it allowed the National Malaria Program to use information on private facilities in their action plan. Now, the census did not gauge quality of services, but it did help plan for quality improvement activities that were conducted later on with the help of the program. Your second question about incentives. There were no tangible incentives provided to health providers. However, there was an immense effort prior to us going to the field and collecting data to explain what the census was all about. And the fact that the private sector was represented by the Alliance, which was a key player, helped a lot with their participation. And your last question is about systems, and this is a great question. Senegal is using DHIS2 to capture public sector data. Now, after the census, we started working with updating the master facility list in DHIS2 so it can capture some of the same information about the private sector. And we started training private providers to report to DHIS2. So that is definitely one part. On the other hand, the private sector division at the Ministry of Health is the division in charge of registering private facilities. I would start there. Strengthening the system at that division would be a good starting point. Thank you.
Thank you so much, Marianne. Maybe now I move to Nicole Capesi. There were a number of questions also that came, and a number have been responded to on the chat. But you can maybe briefly talk about how you tackled the relationship between the public and the private sector, government and private sector. Was the intent to compete or partner, and what you did to build trust between the two sectors?
Yes, thank you for the question, Nelson. So I'd say some of the ways that we've managed to build trust between the two sectors was creating spaces for multi-sectoral discussions on policy and ensuring that our government stakeholders have the opportunity to table and discuss their concerns when it comes to sort of private sector operations, and for the private sector to be able to have an open space to be able to do that as well. We've seen transition in the way that the two sectors are now seeing each other. They're seeing each other more as complementary. And one of the things that we've been able to see as well is that private sector providers are now able to operate sustainably. And they also have, in such a way that they're able to do resilient businesses in addition to their healthcare provision, because we have both parties now, at both structured and ad hoc platforms, being able to dialogue and troubleshoot in real time. Thank you.
Thank you, Nicole. So basically what you're saying is that public-private dialogue is critical for people to share concerns, information, overcome barriers and misconceptions, and see that they have more in common than different in terms of tackling the challenges in the overall health system. Thank you. There's a question for Kamal here that I'll pick so that we have a cross-section of questions. Kamal, what was the role of traditional or religious leaders in this condom campaign?
Thank you for that question. I think we are fortunate that they didn't have a role in this campaign, because what we were actually assuming is that there could be a backlash from the religious leaders, because we are promoting condoms and we're promoting it widely amongst the youth. But fortunately, they did not have a role to play, and there was no backlash as well. So we were able to have a good campaign because of that. Thank you.
Thank you very much. I'll ask each of the presenters to comment on this other question that is coming up. What would you say from your experience are the most effective strategies in public-private engagement in terms of overcoming barriers and building real partnerships that tackle specific issues? From your own experience, what would you say were the most effective strategies? Let me start with Kamal.
Yes, I think what is most effective is to have a neutral broker like Shops Plus to facilitate that engagement between the public and the private sector, and to keep that dialogue going on, because there are trust issues and the public sector does not necessarily trust the private sector. So with a neutral broker like Shops Plus, we were able to provide that space for a dialogue and create that enabling environment where the trust was built between the two actors.
Thank you so much, Kamal. Building trust through a neutral broker. Excellent thought. Marianne, any comment from you, from your experience?
I think this is very important. Yes, and I see there was a question in the chat related to that, is about what the whether I just lost it. Oh, the additional burden on the private sector to be able to report. I actually think that the private sector was really motivated to be heard, and was seeing the potential for new partnerships, the potential to help with their own businesses and their own practices. Thank you.
Thank you so much. Nicole, any comment on your experience regarding what worked very well in terms of building trust and strengthening engagement?
Yes, thanks for the question, Nelson. I think like Kamal and Marianne, and I stressed this in the point before, was being able to have platforms for that dialogue to happen. So having multi-sectoral platforms where you have both the public sector and the private sector in the same room, able to discuss the issues in real time. I think something else that really worked for us as well was working at the national level to be able to embed private sector engagement in the different policies. Because once it's in policy, then that's sort of, you're able to decentralize that to lower levels of government and with implementing partners and the like. And I think something that particularly worked for us is being able to get the public sector to understand what the burden would look like on them if the private sector was not contributing at all to health outcomes. Do they have the resources in place to absorb this shift? Do they have HRH, for example? Do they have the funds? So I think that was, sort of having them understand that it is important to engage with the private sector and for them to sort of complement each other's efforts. Thank you.
Thank you. Another great wisdom there, starting at the top and ensuring that the private sector engagement and dialogue is not ad hoc, it is anchored in national policies and easy to cascade downwards. I'm afraid that is all the time we have for. I would have wanted to continue maybe for another hour or two to talk about this very interesting topic. I really want to thank Kamal, I want to thank Marianne and Nicole for giving us what is really a sneak preview of what Shops Plus did to generate data about the private sector, to guide stewardship and engagement, to strengthen platforms for regular and structured engagement, and to mobilize and strengthen and amplify private sector voice to play their role. A lot of information has been shared on the chat. Please have a look at that. And there is more information available also for our audience in the Shops Plus website that you can look through. And if there's still a matter that you'd really want to continue engaging Shops on this, you are welcome to get in touch with the Shops Plus team. So in the next series that will be upcoming, we'll be talking about health financing, and you're welcome to register for that too. And you can do that at the Shops Plus website. In the next few days also, you will receive an email from us with a recording of today's event. Please feel free to share the recording with friends and colleagues you think would be interested in what we shared and discussed today. I want to thank you so much for making the time to come and listen to us, and we look forward to having another engagement in the next two sessions. Thank you so much and have a great day.